What is, do you think, the aid obligation? Is it to India now? Is it everywhere? Should we be thinking of the Philippines, which may be next? Or where does that responsibility start and end?
Absolutely. I think we have to think about this globally. This is something that WHO have been trying to do ever since, January 2020. We're in a global crisis and we can't respond with simply nationalistic responses. From an aid perspective, yes, absolutely, we should be doing everything we can to support India right now. But what about next month? I mean, what about last month in Brazil, for example? We didn't see the same outpouring of support. We're seeing now worrying trends in Sri Lanka, in Nepal, in Peru. How are we going to be able to cope with this? And we can't work on a system of just bilateral support from one government to another government. And we have to try and pull together in these norms we have around global solidarity for responding to pandemics that have been built over the last 20, 30 years. We really need to see that now in how we respond to the crisis going forward.
How do we balance domestic interests with global interests? I mean, if we look at our own vaccination programme, we're just getting on to vaccinating 30-year-olds. Now, should we stop at this point and say it's more important that we vaccinate the world's healthcare workers or older people in all those countries? And how do you explain that to your own population?
Well, I think there's two different things in there. The first one is, the COVAX scheme, which was set up, rooted in the principles of vaccine equity, was making sure that the most vulnerable around the world were vaccinated first. Vaccinate your frontline healthcare workers, vaccinate the over 80s everywhere in the world. And then after the most vulnerable have been protected, you can then roll out elsewhere in the country. But I actually think there's a second, much more pressing issue, which is something which won't interfere with vaccine programs domestically here in the UK or in the US, which is allowing for other people to produce these vaccines and just rapidly ramp up vaccine distribution. And to do that, we need a waiver of IP protections at the WTO and meaningful tech transfer. And that won't just help now or as soon as we can get that rolling to end this pandemic. But having that capacity built up across the world will be able to support in future health issues, future health crises, and routine development of drugs elsewhere in the world. It's only going to be a good thing for global health.
So when you look at the numbers, for example, 66 million doses of the vaccine was made in India and exported outside. They could have vaccinated their entire key cities with that number, but I guess the choice was made to stick to their contractual obligations rather than vaccinate their own population. Presumably something's going wrong with that kind of economic equation.
Absolutely, but could you imagine the headlines had India put an export ban on those vaccines? We saw what happened when Europe tried to do that earlier this year. And I think, India's also been very keen to promote itself as, the global pharmacy. It's been very strong across generic production of medicines for many years. And we've even seen India donate vaccines to other parts of Southeast Asia and Africa in this. And they're really trying to bolster that part of their economy at the same time as trying to manage this crisis. And as we know, time and time again in this crisis, trying to juggle the kind of economics as well as the public health is something which is going to lead to your downfall.